This is my room scan, and this is my MAR and my provider order, and then these are my whatchamacallit, one-pager, lab sheet, whatever. Yeah. From the top. Okay. So, I would knock, knock, knock. Closes the curtain to provide privacy. There's hand hygiene. No PPE is needed for this room. Hi, my name is Allie. I'm your nursing student for today. Could I get a name and a date of birth?
Joseph Smith, 10/5/1954.
And I scanned that. That scans out correctly. So I'm here today because your healthcare provider wanted me to do give you some medications. Does that sound all right with you?
Yep.
Great. And I'm gonna ask you a few questions. Are you in a comfortable position?
Yep.
Do you have any allergies?
Sulfobetadine.
Okay, and are you experiencing any pain today?
No.
How would you rate your pain on a scale of 0 to 10, 0 being none and 10 being excruciating?
I would say 0.
Okay, and can you take medications by mouth, orally?
Yes.
Okay, and you can swallow okay?
Yes.
Okay, how would you prefer your medication with water or like applesauce?
Water's fine.
Okay, and you're in a comfortable position?
Mm-hmm.
Do you have any concerns or questions before I leave and get that medication for you?
Nope.
Okay, so then I would leave the room. And outside the room. Oh, and also no PPE is needed in the room when I entered in. I would like to make that note. So I'm looking at the MAR versus the provider order, and I am comparing the drugs, and due to the lab results, the only drug that I can give, and her pain level, his pain level, the only drug that I can give is furosemide Lasix, because it's within the normal range. His potassium level is 3.5, sodium 136, and BUN is 19. Nursing considerations for this is HF axis, fluid volume status, monitor electrolytes, hypertension, and autocity. Uses are for pulmonary edema, and HF, neuropathic syndrome, ascites, hepatic disease, and hypertension. Yeah. And then I don't need to give the oxycodone because oxycodone, acetaminophen, because she doesn't have high pain. And the uses for this is for antispasmodic, for neuralgic bladder, overactive bladder, and females OTC. He does not need that because it's for high pain. Codeine, acetaminophen, Tylenol number 3 is for low pain. He did not say that he was in any pain. It is for mild to moderate to severe pain, cough. And digoxin, his digoxin levels are too high. It's supposed to be between 0.8 and 2, but his labs say he's at a 2.1. Do not give. His uses are atrial fibrillation, flutter, heart failure. Warfarin, no warfarin because INR levels are too high. No anticoagulants. Level toxic is 3.6. Uses are for antiphospholipid antibody syndrome, aortic thrombolism, prophylaxis deep vein thrombosis, MI prophylaxis post-MI stroke, prophylaxis thrombosis, prophylaxis pulmonary embolism. So I will only be giving the furosemide, and I'm comparing it to the MAR and the provider order. Furosemide laxant, 40 milligrams by mouth twice daily. It is a CHF, and it is active order. And it is for a Joseph Smith. And I can give it to him at $1,100. So I'm grabbing the med out. Okay, get that ready. Okay, so I'm looking at the med and I'm doing my first check. So it is for furosemide, and it is furosemide laxant, 40 milligrams. Actually, this is 20 milligrams. I need 2 of them to make 40 milligrams. 20 to make 40 milligrams. By mouth twice daily. Double check. Yep, by mouth twice daily. And it is for a Joseph Smith. Right route, right dose, 40 milligrams, right time. So it is twice daily, and so he can take it at 1,100 hours. Dose, right time, right route, right patient. So it is for Joseph Smith, and it is right drug. It is furosemide laxant. Okay, so put that in here, and I would scan both drugs, and I would check the expiration date, which is 8/20/38, and make sure that is the right drug and right dose when I scan, and also checking the packaging and integrity of the packaging. So I would put it back in here and check it out again for my second check. So it is for a Joseph Smith. So right patient, right drug is furosemide laxant. And right route, by mouth twice daily, and right dose, 40 milligrams. So this is 20, 2 of them is 40, so it's 40 milligrams. Right time, so it is twice daily, and I can give it to him at 11 o'clock or 1,100 hours. So then I would scan it again to make sure that it's the right drug, right dose, and check the integrity of the packaging. Looks good to me. The expiration date is 8/20/38, and I would put it in the cup. The uses for this drug is for pulmonary edema and HF neuropathic syndrome, ascites, hepatic disease, hypertension. Nursing considerations include HFSS fluid volume status, monitor electrolytes, hypertension, ototoxicity, hypokalemia. And the action acts on ascending loop of Hynol in the kidney, inhibiting reabsorption of electrolytes, sodium and chloride, causing excretion of sodium, calcium, magnesium, chloride, water, and some potassium. So some adverse reactions that I'll also mention to her on my third check would be CNS, headache, fatigue, weakness, vertigo, orthostatic hypotension, chest pain, ECG changes, loss of hearing, ear pain, blurred vision, hypokalemia, hypochloremia, alkalosis, hypomagnesium, hyponatremia, metabolic alkalosis. So then I would do my third check. So I would knock, knock, knock. And I would enter the room. So pretend I entered the room, closing the curtain for some privacy. Performs hand hygiene. There is no PPE needed for this room. And hi. Also, when I was doing my first and second check, I would also make sure that it does not need to be crushed or split or discarded. So I perform my hand hygiene. Hi, my name is Allie, and close the curtain for privacy, no PPE needed. Hi, my name is Allie. I'm your student nurse for today. Can I get a name and a date of birth?
Joseph Smith, 10/5/54.
And I would scan that. That scans out correct. I'm here to give you your medication. Do you have any allergies?
Sulfobetadine.
Okay. And I'm just verifying, can you take medication by mouth?
Yes.
And swallow, okay?
Yes.
Alright, I have a cup of water with me as well for the medication that you'll be able to swallow. So are you okay with the okay if I give you your medication?
Mm-hmm.
Okay, and you don't have, are you in a comfortable position?
Yes.
Okay, so a few things here. I will be giving you just your furosemide Lasix, because it's for, your, uses are for pulmonary edema, and HF neuropathic system syndrome, ascites, hepatic disease, hypertension. Nursing considerations are HF, access fluid volume status, monitor electrolytes, hypertension, ototoxicity, hypokalemia. Some adverse reaction side effects that you should know is headache, fatigue, weakness, vertigo, orthostatic hypotension, chest pain, ECG changes, loss of hearing, ear pain, tetanus, blurred vision, hypokalemia, hypochloremia, alkalosis, hypomagnesium, hyponatremia, metabolic alkalosis. So the action acts on the ascending loop of Hynol in the kidney, inhibiting reabsorption of electrolytes, sodium and chlorine, causing excretion of sodium, calcium, and magnesium, chloride, and water, and some potassium. We will be giving you that medication because your potassium, your lab levels came back and it's within the normal range. Your potassium's at 3.5, sodium 136, and BUN is at 19. And we will not be giving you your warfarin because your levels are too toxic. Your INR levels are too high. No warfarin because no anticoagulants. It's at your toxic levels at about 3.6. And the uses for this is antiphospholipid antibody syndrome, aerial thrombolism, prophylaxis, deep vein thrombosis, MI prophylaxis post-MI stroke, prophylaxis thrombosis, prophylaxis pulmonary embolism. he'll not be giving you that. And the Jackson, will not be giving you because your level is too high. It's supposed to be between 0.8 and 2, but your labs say that you're at a 2.1, cannot give. The uses are for atrial fibrillation, flutter, heart failure. And then, yeah, so then you have your codeine, acetaminophen, Tylenol number 3, which is for low pain, and you said that you had no pain, so I am not giving you any medication for that. It is for mild to moderate to severe pain, cough. And then there's your oxycodone, acetaminophen, oxycodone, acetaminophen. This is for high pain, and you said that you did not have any pain, so we're not going to give you that. It is for antispasmodic for neurologic bladder, overactive bladder, and females OTC. So we will be giving you your furosemide. What's your knowledge on this drug?
It can give me fatigue and headaches, and it's used for pulmonary edema.
Good job. So then I will be doing my third check. So I am looking. It is for Joseph Smith. Joseph Smith, right patient, right drug. So the right drug is furosemide Lasix. Furosemide Lasix. Here we're looking to furosemide Lasix. Furosemide Lasix. And it is for 40 milligrams. So right dose is 40 milligrams. So this is 20. This is 20. So that's 40 milligrams. Right route is by mouth. By mouth. He said that he can take it by mouth as well. That is correct, right? Yeah.
Yes.
Said you can take it by mouth.
Yep.
And it is twice daily. So then, yep, twice daily. So he can take it at 1,100 hours, which we will be giving to now. And I did right drug, furosemide, right route, by mouth, right time, right patient, Joseph Smith, and right drug, route, patient, time. Yeah. Route, drug, patient, time. Right route, right drug, right patient, right time, right dose. So it is for 40 milligrams. Yep, I'm just double checking myself, sorry. So I would scan this, and I would scan this with my scanner to make sure that it is the right drug and the right dose, which it is, and the expiration date is 8/20/38, 8/20/38, and the integrity of the package is good, like there's no rips or anything. So then I would open it in front of my patient. Do you have any concerns before we begin?
No.
Okay. So then I would open up the medication and put it in the cup, and here's some water, if you could take it. Okay, can you open your mouth so I can make sure that you took your medication? Okay, and so everything looks good. Do you have any questions or concerns?
No.
Are you in a comfortable position?
Yes.
I'm gonna come back in 30 minutes to check up on you to see if there's adverse side effects. And if there are, I will withhold the drug, let the care provider know, let the pharmacist know, document as per policy, and do your vital signs. Does that sound okay?
Yep.
Okay. Do you anything else while I'm here? I have time.
Nope.
So then I would perform my 5 safety measures, which is lock the bed, lower the bed, put the side rails up, give you your call light. Lock the bed, lower the bed, put the side rails up, give you your call light, and then give you your side table within reach, and then I'd clear the room of any fall risk-free things as well. Yeah. You don't have any questions or concerns for me? Okay. And then I would perform my hand hygiene and clean up my supplies and cleanse the area. And when I was also doing my 3rd check, I made sure that the medication did not need to be crushed, split, or discarded as well. And then I would exit the room and I would document as needed and let the healthcare provider know of any changes.